Hello and welcome to another video in Foundations in Maternal and Newborn Health. In today's video, we're going to talk about the immune system of the newborn. So immune system of the newborn. In the last video, we talked a little bit about factors that can cross the placenta, and at the end of that video, I mentioned antibodies, and specifically IgG antibodies. So that's sort of the most important thing to note, is that only IgG antibodies can cross the placental barrier. So only IgG antibodies. And so IgG antibodies are the only ones that can cross because they're actually the smallest. And so we talked about this in an earlier immunology video, but they look like these little Ys, and they're very, very, very small. And so I'll draw it here as just a Y, and they come in from the maternal blood, and they can actually cross this placental border here, and they move down through the placenta into the umbilical cord and then into the baby. And so this is really valuable for the baby because it actually provides protection after it's born. So protects newborn. So after the baby's born, its immune system is too underdeveloped, it's too young to produce its own antibodies. And so IgG antibodies from the mother that's passed to the baby during pregnancy and when the baby's growing will protect the baby from pathogens that the mom's been exposed to for long enough for the baby to grow and develop enough of an immune system to get its own vaccines. So this works for both pathogens that the mom's been exposed to. So mom's exposed pathogens. So those are things that maybe she's gotten sick in the past and she's produced antibodies against. And this also works for vaccines that the mom's had. So if the mom gets a vaccine, she'll produce IgG antibodies, and those antibodies can be transferred to the baby. So that's also a really important note, is that vaccine immunity passes to baby. Okay, so this is used in the case of something like pertussis. So during pregnancy, the mother might get the pertussis vaccine, and that vaccine will elicit an immune response, or will cause the mother to produce these IgG antibodies, and then the mother can pass these antibodies to the baby, and then when the baby's born, for the first few months before it can get its own pertussis vaccine, it'll have some protection from the mom's antibodies.